So these were important etiological factors for alcohol use disorder.
Now let's talk about classifications of alcoholism, or very commonly known as various typologies in alcoholism. Again, there have been certain classifications which are proposed to classify alcoholism into different categories. There are various classifications, and you will find some mention of these classifications even in Kaplan's doc CDP, where you may read about type A or type B and type 1 or type 2. So we'll talk about some of these classifications. It may not be always possible to classify an individual into this classification, but since many of these classifications and pathologies have been proposed, you should have an idea about them. And many times the examiner may also ask you, any viva about these typologies. So let's discuss them one by one. First classification of typology which we discuss is of Babler's, or the Babler's classification, which classify alcoholism into type A and type B. In fact, the name type A has been given after the Roman god Apollo. By type B, the name is given on Roman god Bacchus. So let's try to understand some of these characteristics of these typology. So when we talk about these two classification, one is age of onset. So when we talk about the age of onset, it is seen that type A, the age of onset is late, while in type B, the age of onset is early. Second is, when we talk about the childhood, it is seen that type A usually have fewer early risk factors, while type B, they would have more risk factors, such as conduct disorder may be present in the childhood. Then coming to gender, it is seen that type A may be equally seen in both males and females, while type B is more common in males. Coming to etiology, it is seen that more environmental factors are present in type A etiology, while there are more genetic factors which are present in type B alcoholism. And when we talk about personality, such as impulsivity, novelty seeking, it is seen that it is low in type A, while it is high in type B. Then coming to family history, again, we've discussed that genetic factors are more in type B. So you can, remember it is more in type B, and the family history positive is less in type A. And coming to psychopathology, again, in type B, higher severity is seen, and, ASPD, antisocial personality disorder may be seen, criminality may also be present, while it is less severe in type A. And when we talk about alcohol or substance use, it is more severe and more chronic in type B. Again, you can see type B, if you see, it is early onset, it is very dominated, more genetic factors, more severity. And even severe polydrug use may also be present in type B, while the use is less severe in type A, and also it is more of episodic rather than the more chronic. And when we talk about the treatment, so study done by Lit et al. In 1992, it was shown that interaction group therapy, where importance of functioning relationship is, taught, that has shown to be more effective in type A, while type B, it is seen that coping skill training, teaching coping skills, which will help preventing relapse, or which may help in identifying risk factors for relapse, again, they may help in type B. So this is type A and type B. So this is Babler's classification, and again, you may find mention of type A, type B in CTP as well. Now let's talk about another classification, that is Cloninger classification. Cloninger classification, here it is in divided into type 1 and type 2. In fact, it is very similar. If you see, we talk about this Cloninger type 1 is very similar to Babler type A. Cloninger type 2 is very similar to Babler type B. So again, a lot of similarities are there, but let's talk about this. So type 1 is milieu limited, that is environmental factors again play an important role, while type 2 is considered as male limited, more in males. So let's discuss some of the important factors present in each of these. So when we talk about the gender, again, as the name suggests, type 2 is male limited, so it is mostly in males, while type 1 is seen in both. So again, you can correlate even when we're talking about that bar, it was A was equal in males and females, while B was more in males. Now, when we talk about onset, again, type 2 is early onset, so onset is less than 25 years of age, while in type 2, it is more than 25 years of age. Coming to the etiology, again, genetic factors may be present in both. And when we talk about environmental factors, they are present in type 1, they are limited in type 2. So again, type 1 is more of environmental influence, while type 2 is more of genetic factors influenced. When we talk about family history, again, family history is usually found to be positive in type 2, while it may be positive in type 1. And if we see loss of control is present here and it is absent in type 2. And when we talk about, again, a pre-morbid personality, in type 2, novelty seeking is higher in type 2, while harm avoidance, high reward dependence is seen in type 1. And coming to other factors, some of the other factors related to type 2 is that drinking may be followed by aggressive behavior. So many times you'll see that social impairment may occur after consuming alcohol, and there is also spontaneous alcohol seeking may be seen in type 2. While in type 1, when we see there is more of psychological dependence is seen, and also guilt after consuming alcohol is also seen in type 1. So these were some important factors or differentiating points in the Chroninger type 1 and type 2 typology. Now, another typology, again, we'll just briefly discuss. So again, when you see in many articles, you see, important material related to these typology, you find various classifications. So I'll just, again, touch upon this one more classification, that is niche typology, and it has divided alcoholism into 4 syndromes, that is type 1, type 2, type 3, and type 4. So let's discuss briefly some of the important ones. Again, they may be classified, based on the symptoms seen, and also treatment also vary in these different typologies. So let's briefly discuss them. When you talk about type 1 is allergy model, you can remember. So craving is due to alcohol, and there may be severe withdrawals may be seen. So the craving is to consume alcohol, and severe withdrawals may be seen. And in fact, in this, many times it is seen drugs such as acamprosate. So acamprosate may show a role in the management, and other drugs such as naltrexone and even disulfiram may also be. But it is seen again that in such patients, acamprosate, it is seen that in these patients, acamprosate may be of good use when you manage. So we'll talk about these drugs when we talk about, in the rehabilitation, the management, we'll talk about these drugs. Now, when we talk about type 2 is conflict solving. And here, basically, craving is due to stress. And sometimes it is, alcohol is used as a self-medication to decrease the stress. And in fact, in these patients, it is seen that sometimes management with psychotherapy, such as teaching coping skills, may be of more use. Again, of course, that is also be used. Then next is type 3. Type 3 is depressive mania. That is, here the craving was due to mood. So in these patients, you may find family history of alcohol or even mood or affective disorders. And sometimes drugs such as lithium, carbamazepine, they may also be used for the management. And lastly, in type 4, it is the conditioning model. Here, craving is due to compulsion. I mean, many times a patient may have compulsions. And interestingly, it is seen that in these patients, there may be severe somatic disease before 14 years of age. So cerebral damage may be there before 14 years, or there may be some childhood problems such as stuttering or enuresis, which may be seen in these individuals. So these are, 4 types in the niche typology. Now, since we are discussing these typology, let's also discuss genomics, 5 types of alcoholism or 5 species, as sometimes it is used. And in fact, if you're read in your undergraduate days, in Neeraj Ahuja in textbook, if you've read that, so in this genomic classification, you might have even read there as well. Now, it's an older way of classification, more and more recent classification that's come after this. But since, this is a very, older way of classifying, let's also briefly discuss. So in genomic classification, there are five types: alpha, beta, gamma, delta, and epsilon. So these are the four types. Then let's discuss briefly one by one. So in alpha, there is excessive and inappropriate drinking to relieve physical and or emotional pain. And in these, psychological dependence is usually seen. In beta, it is seen that physical complications, such as liver cirrhosis and gastritis, such complications may be seen, and there is no dependence is seen in the beta type. Now, discussing about gamma, again, gamma is also known as malignant alcoholism. So you can remember, in fact, if you've seen Avengers, gamma radiation have affected a lot of Avengers. So gamma, again, you can remember malignant, or you can remember gamma. So there is M. So malignant alcoholism is also known as here. Basically, it is seen that psychological dependence is earlier. That is more of craving is there, then followed by physical dependence, that is tolerance, withdrawal symptoms. And then next is delta. Here, physical is first, then psychological dependence, and more social and economic influences are there which cause drinking. And in fact, it is seen that gamma and delta, these are the two subtypes, which specifically show evidence of true disease entities. So these are the two where you may find alcohol use disorder as a disease entity may be seen. And last is epsilon. It is basically dipsomania or compulsive drinking. So there is a spree of drinking, or there is binge drinking, which is seen in the individual. So this is the genetic classification. These are the 5 types. So this was about typology of alcohol use disorder. Again, an important topic, especially for the Viva exam. And since it is also mentioned in this classification in the textbook, so one should have an idea about these typologies.